Hi, welcome to another episode of Medicine Simplified. In this video, we will know about anatomy of joints, its functions and classification. So what is joint? Joint is a junction between two or more bones. It is a device that permits movement of bone. Every bone in the body is connected to or forms a joint. That means every bone forms a joint or it is connected to a joint, except higher bone. There are total 230 joints in body. Coming to the functions of joint, it provides structural support. That means it holds the skeletal bones together. Next is articulation. It allows the skeleton some flexibility. That means movement. Next is it makes bone growth possible. Also, it permits certain structures to change shape during childbirth. Example, pubic symphysis. Coming to the classification of joints, they are classified into structural and functional. Structural classification is determined by how the bones connect to each other, and functional classification is determined by degree of movement between articulating bones. Coming to the structural classification, it is further classified into fibrous or fixed joint. There are total 3 types of fibrous joints. First one is sutures, next is gomphosis, next syndesmosis. Next type of structural joint is cartilaginous joint, which provides slight movements. They are further classified into primary cartilaginous joints or synchondrosis joint. Next is secondary cartilaginous joint or symphysis. Final one is synovial joint or freely movable joints, which is further classified into plane, hinge, pivot, bicondylar, ellipsoid, saddle and ball and socket. Let's know structural classification in detail. First type of joint under structural classification is fibrous joint. In this type of joints, bones are joined by fibrous connective tissue consisting mainly of collagen. Fibrous joints are further divided into 3 types. First one is sutures or synostosis. These type of joints are found between bones of skull. Next is syndesmosis. These type of joints are found where two adjacent bones joined together by greater amount of connective tissue than in sutures, in form of interosseous ligaments and membranes. Example are interosseous radioulnar joint, interosseous tibiofibular joint. Next is gomphosis. It is a specialized fibrous joint restricted to fixation of teeth in alveolar sockets of maxilla or mandible. The root of tooth is attached to socket within alveolus by periodontal ligament. Next type of joint in structural classification is cartilaginous joints. In this type of joint, the bones are joined by cartilage. Cartilaginous joints are further divided into 2 types. First one is primary cartilaginous joint, also known as synchondrosis. In this joint, bone forming joints are connected by plate of hyaline cartilage. These joints are immovable. They may ossify with age. Example are joint between first rib and manubrium of sternum. Next is joint between epiphysis and diaphysis of growing long bones. Next type of cartilaginous joint is secondary cartilaginous joint, also known as symphysis. In these joints, the articular surface of bone forming the joint are covered by thin plates of hyaline cartilage, which are connected by a disc of fibrocartilage. Examples are symphysis pubis, intervertebral disc, symphysis mente of mandible. Next type of joint under structural classification is synovial joints, also known as diarthroidal joint. This joint possesses a cavity and the articular ends of bones forming the cavity are enclosed in fibrous capsule. As a result, they are separated by narrow cavity. The articular cavity, which is filled with fluid called as synovial fluid, That's why they are called as synovial joints. Synovial joints are further divided into 7 types. First one is plain joint. In this type of joints, articular surfaces are more or less flat. They permit gliding movements in various directions. Example are intercarpal joints, intertarsal joints. Next is hinge joint. In this type of joints, articular surfaces are pulley shaped. This type of joints permit movement in one plane around transverse axis. These movements consist of flexion and extension. Example are elbow joint and knee joint. Next is pivot joint. In this type of joints, articular surface of one bone is rounded and fits into concavity of another bone. Movement is limited to rotation around a central axis. Example of joints between proximal ends of radius and ulna. Next is condylar joint. In this type of joints, round articular surface of one bone fits into socket type articular surface of another bone. End of bone bearing around articular surface is called condyle. This joint permit movement in 2 directions. Example, temporomandibular joint and knee joint. Next is ellipsoid joint. In this type of joints, elliptical convex surface of one bone articulates with elliptical concave surface of another bone. Movements are permitted in 2 directions. Example are wrist joint, metacarpo and metatarsophalangeal joints. Next type of joint is saddle joint. In this type of joints, articular surfaces are reciprocally saddle shaped, that is concavo-convex. Example are joint between trapezius and metacarpal bones of thumb and sternoclavicular joint. Final one is ball and socket joint. This joint consists of a bone with ball shaped head that attaches with cup shaped cavity of another bone. This type of joint allows for a wider range of motion than any other kind. It permits movements in all planes and rotational movements around axis. Example, hip and shoulder joints. Coming to the functional classification of joints, they are divided into 3 types. First one is synarthrosis. These joints permit little or no mobility. Most synarthrosis joints are fibrous joints. Example are cranial sutures in adults. Next is amphiarthrosis. These joints permit slight mobility. The 2 bone surfaces at the joint are covered in hyaline cartilage and joined by strands of fibrocartilage. Example are symphysis pubis, symphysis mentae and intervertebral disc. Third one is diarthrosis. These joints permit a variety of movements. Only synovial joints are diarthroidal. These are types of joints present in human body. If you like this video, please like, share and subscribe to our channel. Thank you.